Hello guys, so I'm back with part 2 of my fibro video, and this video is dedicated strictly to symptoms, and because there are so many of them, I'm just going to jump right into them. I found an amazing list online by a fibromyalgia specialist who compiled this list of all these symptoms, and so I'm just going to list them all off, and then I'm going to go in depth on just a few of them that are, I feel like, more important. So let me get my list going on here. Give me just a second. Okay. So the fibromyalgia symptoms are, and now these don't affect everybody, okay, and everybody don't have all of these symptoms at one time, but this is a list of symptoms that people with fibromyalgia do have, either together, separately, or whatever. Some general symptoms are delayed reactions to physical exertion or stressful events, sweats, unexplained weight gain or loss, cravings for carbohydrate and chocolate, yeah, headaches and migraines, vision changes including rapidly worsening vision, pain that ranges from mild to severe and may move around the body, morning stiffness, muscle twitches, diffuse swelling, fibrocystic, lumpy, tender breast, which, yeah, very, I had no idea that that was actually a symptom of fibro. Something to talk to my doctor about. Allergies, runny nose, mold and yeast sensitivity, which we just get sensitivity all over. Shortness of breath, earaches, itchy ears and ringing ears, thick secretions, light and or broken sleep pattern with unrefreshing sleep, fatigue, sleep starts, which is the falling sensations, teeth grinding, menstrual problems, loss of libido, impotence, loss of libido, bloating, abdominal cramps, pelvic pain, irritable bowel syndrome, urinary frequency, difficulty speaking known words, other language impairments, which is so effing true, directional disorientation, poor balance and coordination, paresthesiasis in the upper limbs, which is tingling or the burning sensations. I didn't know that was the name of that. Loss of ability to distinguish some shades of color, so that's with the vision impairment. Short-term memory impairment, the fibro fog. Confusion, trouble concentrating, staring into space before brain kicks in. They did so good with this list, because I swear sometimes I would just look up and you could be talking to me and I'll be like, and it takes me a minute to really come down to earth. So that was dead on. It's funny. Inability to recognize familiar surroundings. Oh yeah. Sensitivity all over, to odors, to pressure changes, temperature and humidity, to light, to noise, night driving difficulty and sensory overload. Emotional is panic attacks, depression, tendency to cry easily. It's like a fucking baby. Free floating anxiety, mood swings, and unaccountable irritability. All very true. Heart related, mitral valve prolapse, which is an overlapping condition, a rapid, fluttery, irregular heartbeat. That I get an irregular heartbeat quite often. Pain that mimics a heart attack. That's kind of like an overlapping condition. For skin, hair, and nail related, pronounced nail ridges, nails that curve under, mottled skin, bruising or scarring easily. I bruise and you don't even have to touch me. Temporary hair loss and tissue overgrowth, and you can get nosebleeds and hemorrhoids. So those are just some of the symptoms that some fibromyalgia patients can have. They didn't have on there TMJ, which is temporomandibular joint dysfunction, which is lockjaw, and that doesn't happen to me often, but when it does, it's a very annoying little thing. I just massage my jaws like this, and it hurt like right back in there, and I just will eat soft foods and fruits and whatnot. Dry eyes and mouth, dizziness, and a stabbing pain. It is, yeah, it's just, it's hard to explain. It's a stabbing pain, like you're literally being stabbed. yeah, they pretty much went over everything in there. That's crazy. So I didn't even know some of those are on that list. But that is an intense list of what someone with fibromyalgia goes through. I'd say of that list of over, it's a big list. I have about half of those issues I've suffered at one point. The main thing that I want to help you guys understand is the pain. What is a fibromyalgia pain? You keep hearing chronic pain disorder, pain, fatigue. What is it? The best way to describe it is if you've ever had the flu or a cold, and you wake up and your body feels very heavy, it's very stiff, you don't know what to do, you feel like this big log, you feel heavy, like you don't know what to do with yourself. That is what a fibromyalgia patient feels like every day. Our bones hurt, our muscles hurt. For me, I'll just give you an example of where I hurt on the pain scale. So right now, as I sit here talking to you guys, I'm at like a level 7 of pain from 1 to 10. And the reason I can smile and I can be so casual about it is because I've been hurting for almost 10 years now. So it isn't nothing that I'm not used to. But my pain is right here on the back of my shoulders, so my shoulder blades, right there. It is so knotty. Like, you can punch me right there, and I'd probably hurt you with how hard of a knot it is in the back of my shoulders. And right now, they're seeming to burn, and it's because it's 1:30 in the morning. It happens around this time because I should be asleep, but I can't sleep. So, the pain that I feel the most is in my wrist, and I normally have my wrist brace on, which I don't now because it's late and I'm at home. But when I get to talking about that, I'll show you what my brace looks like. And so my pain is all up in here on both hands. And elbow pain is something that they didn't mention. And it's crazy because elbow pain, literally like around there, you would be amazed at how much that little area hurts. And so that's my level of pain right now, where I'm at. But like I said, I'm used to it, so I'm able to sit through it. I talked about tender points on the first video, and tender points is what the doctor uses to determine whether it's fibro, and they apply firm pressure to these areas. And like I said, almost every fibromyalgia patient will feel pain in these areas, and some of these areas are the back of the head. So definitely right along there, between the shoulder blades, so on the front and then on the back and on top of the shoulders. Front sides of the neck, so right here in the back of the neck. The upper chest, lots of chest pain going on. Outer elbows, that was what I showed you, so around the elbows is a lot of pain there. The upper hips, just pressing that area right there hurts. My rib cages feel like I've been hit with a baseball bat. So every time I have to scratch my ribs or in that area, I get really, like I wince up because I know that the pain I'm going to feel is going to last for about 30 seconds afterwards, and there's really nothing I could do about it. The sides of the hips, the upper hips, and then the inner knees. So those are places that when you go to the doctor and they say, you know, we're going to do the trigger point test, that's where they test you by just applying pressure like that. That hurt. And that tells them, you know, that you have these areas associated with fibromyalgia. The level of that a pain that a person feels with fibro, it is not your average pain. It is not your stubbing the toe. It is not your hitting the funny bone. Right now, I feel very hot. Even though my AC is on, I feel like I'm at 160 degrees. The pain is radiating heat on my body, and so I feel very uncomfortable with myself. Even though I sit here and if you see me like constantly moving and moving my hands, it's because the longer I sit still, and the more I feel the pain, so I have to constantly just move. Like I have ADHD, you know, I just gotta move to stay and to not feel the pain so much. Someone who does experience a lot of pain, it incapacitates you like there's no tomorrow. For me, walking is very hard to do. I I end up walking with a limp or a penguin walk, which I used to be embarrassed of, but now I don't care. I can walk, I can use my limbs. So if I have to limp or penguin walk or walk on the sides of my feet every now and again, so be it. It's what it is. Um, but d- doing things like walking hurts. For me, I cannot open any jars in my house of anything. It takes me a very long time to open up like a jar of, let's say, jelly. So, and it gets to the point where I'll cry. I'll be in the kitchen and I would really want a pickle. And I just bought the pickles from the store and I can't open it. And I'm sitting there like slightly banging it, when you bang the jar on the side of the counter. And I'll get a towel. But the more that I turn, the more my wrist starts to hurt. And my wrists are the worst parts of my body. So I just sit there and I'm like, oh, why can't they make everything like peanut butter jars? Just put it in plastic, damn it. I made the mistake of going to the pharmacy and they gave me child-proof caps, and I can't open child-proof caps. So I have to show my son how to open child-proof caps for me. I don't take a lot of medication, but when I do, they have to have the pop tops or I cannot twist and open them. So that's just a peek into, someone like me suffer from with pain and what I'm limited in doing. I'm not supposed to be carrying a big purse, but yeah, that's not gonna happen. Sorry, doc. So the pain is all over, and the next video that I'm gonna do, I don't know if I'm gonna do a my story video yet. I'm not sure if I'm comfortable with that yet, but I think I'll probably do a medication video, and then at some point I'm really gonna talk about my own story and what I deal with fibro. What a day for me is like this condition, and so that's it. That's my 12 minutes of your time, and it's 1:30 right now, so I'm gonna try to get myself something to eat, and I will continue this tomorrow. If I think about any more symptoms, or if you have any questions, feel free to leave questions. I'm cool with answering questions. If you don't believe in fibro, that's totally okay. Keep it to yourself. We don't care. And thanks for watching. Bye.